The following information is intended for educational purposes only. It is not medical advice. The views expressed do not necessarily reflect those of A Rude Awakening International nor this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor A Rude Awakening International nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.
The old adage, you are what you eat, has more truth to it than most people realize. What you put in your mouth creates who you are. But the mouth itself also plays an equal role in the overall health of your entire body. You may already know that the health of your mouth can determine the health of your heart, for example. But did you know that every tooth in your mouth has a direct line to other major parts of your body, like your lungs, your pancreas, liver, eyes, kidneys, stomach, etc.? Dentistry is far more than fillings and root canals. It can be the key to your health or a detriment to your health, depending on who is doing your dentistry. And today we're going to talk about it with Dr. Thom Lokensgard of the Center for Holistic and Biological Dentistry in Nashville, Tennessee. And he's about to give you a health awakening. Welcome to the Health Awakening. I'm your host, Scott Laird. Forget everything you know about going to the dentist. Now, imagine you could go to someone who could help the health of your entire body just by examining the health of your mouth and your teeth. Dr. Thom Lokensgard is the founder of the Center for Holistic and Biological Dentistry in Nashville, Tennessee. He is also a naturopathic medical doctor, a member of the Holistic Dental Association, and a fellow with the American Academy of Anti-Aging Medicine, and a diplomate of the American Academy of Anti-Aging Medicine. He is even one of America's top 50 functional and integrative medical doctors, including Dr. Oz, Dr. Mercola, and Dr. Neil Barnard and Dr. David Brownstein, who have both been on this show. Dr. Lokensgard, that is quite the resume. Welcome to the Health Awakening.
Well, thank you, Scott. It's a pleasure and honor to be here. I love your town. I love Charlotte.
Oh, it's a wonderful place, isn't it?
I've ever been here.
Well, we're glad you're here, and I think we're going to have more people going to Nashville after they hear what we have to talk about today.
I'm incredibly honored to be here.
Well, tell us, what is the difference between conventional dentistry and holistic or biological dentistry? What's the difference here?
Good question. There's about a 70-30 split. When I was trained as a traditional biological dentist, and then one day this young lady comes into my office and she goes, "I don't want you giving our kids fluoride." And I'm like, "What? What do you mean you don't want me to give you fluoride?" You know, she goes, and I'm kind of having this meltdown, thinking, although she said I never got mad at her, but I was trained to do all the things that we do in dentistry, like fluoride treatments, root canals, mercury fillings, but it was basically considered at that time drill, fill, and bill. And you'd find a little etch in the enamel, you'd find a little hole in the tooth, and you would just drill it out and tell people to go on their way. But I had this incredible feeling that I wasn't really helping people. So now, to fast forward to today, we have integrative medicine, we have integrative functional dentistry, we have functional dentistry and functional medicine. And so basically what we're trying to do is get to the cause of people's health concerns. Because we see a lot of train wrecks. We see a lot of people that have a lot of issues and they end up in our office because they've got failed root canals, they've got metal toxicity issues, which is a big deal, a super big deal. And then we're putting mercury next to the blood-brain barrier in young children, which doesn't make any sense to me at all. So we've kind of come full circle now, realizing that some of the things that they were doing in the 1920s with Weston A. Price, with Frank Pottinger, who did these studies, these amazing studies, and would show categorically that people that ate healthy diets had healthy conditions in their mouth and in their dentition, and they had well-developed arches, which has a lot to do with airway constriction.
Let's get into that just for a moment.
Yeah.
So the arches, by the way.
Yeah.
So we were having a conversation just before we started shooting here, and you were mentioning that the shape of someone's arch in their mouth has a lot to do with their health.
Absolutely.
How does that work? Explain that.
Absolutely. Well, it all has to do with metabolism and oxygen. If you have a very narrow arch, the maxilla, for example, then what happens is your tongue and your jaw is forced back and impinges on the pharyngeal airway space. And so then you end up becoming a mouth breather, and when you become a mouth breather, then you're burning oxygen at the rate of 2 ATP per essential fatty acid in the Krebs cycle versus 38 ATP if you have a fully functioning mouth. Let me start here.
Okay.
When I had graduated, I'd been out of medical or dental school for about 6 or 7 years, and I was at an orthodontic convention. And this orthodontist says, why are you guys doing orthodontics? And the obvious answer was, well, because your mouth is crowded. So, and then he posed another question. He said, because this was an expansion orthodontic class, which I hadn't been trained to do. This is kind of the holistic part of it. And so he said, well, the reason that you're straightening teeth is because, or your arches are crowded, is because you don't have enough room and the arches are too narrow. So he said, let me ask you a question. Why would you take out 4 perfectly good teeth, meaning your 4 cuspids, we call it 4 in the floor bicuspid, orthodontics. Why would you take those out and narrow down and crowd down the arch even further? And I thought to myself, well, that's because we're stupid, maybe. And he said, no, because you've been taught wrong. And so the arch expansion thing came into play. And when you have a high vaulted palate, when you have a narrow arch form, you have to get in there with an expander as long as those alveolar plates are still growing, as long as the bony plates are still open and still growing, in like a 7-year-old to a 12-year-old kid. By the time you're 12, you're about 90% done growing in your face. By the time you're 18, you're almost 100%, and then those bony sutures close. But that has a lot to do with the airway space and the consumption of oxygen. And if you're not getting enough oxygen, if you're not sleeping well, if you're choking and you're waking up and you have obstructive sleep apnea, which is a whole other field of dentistry, then you're having some serious issues because you're not utilizing human growth hormone. You're not releasing it at the right time. You're not doing a rejuvenation of the liver, which happens about 1 a.m. But you've got to get to REM sleep for all these things to happen.
Interesting. So you can actually expand that in somebody's mouth.
That's what we do,
but only when you're young. Otherwise,
right?
Okay.
Well, no, you can actually do it in an adult, but you have to open up the spaces first.
Interesting. All right. Well, we're getting way past regular dentistry here with Dr. Thom Lokensgard, and we'll be back to talk more on the Health Awakening. Stay tuned. And welcome back to the Health Awakening. Before the break, we were talking with our guest, Dr. Thom Lokensgard, about not only just teeth, but the shape of your mouth and what that can do to the rest of your health. So, Dr. Lokensgard, we had talked about how ideally we want to fix that part of the mouth when a child is young before they stop growing. But say someone's my age in their 40s, can something be done?
Well, you're correct, and you're correct. What you want to do is you want to get the kids in, start them young because that's when they're still growing. Get rid of the tongue tie and develop out the arches. We call this orthopedic orthodontics. But when you're an adult, we've had adult patients that have extremely constricted arches, and we put appliances. It just takes a lot longer, but it's still very effective. And the longer it takes, the cool thing about expansion ortho is that it doesn't relapse. Like when you take bicuspid teeth out and you crowd down the arch even further, like this orthodontic guy was talking to us, back in the day, what happens is the whole arch can relapse. That's how Invisalign was born, as a matter of fact. But in an adult, you can still go in there, but it just takes longer.
Okay, now speaking of adults, a lot of adults are diagnosed with heart disease.
Yep.
Some people have started making the connection between heart disease and periodontal disease. What is that connection? How does it work?
The Harvard Medical School made that connection back in 2001. They connected that undeniably periodontal disease, which is an infection in your mouth, will cause cardiovascular disease, heart attacks, and strokes. So the mechanism is this: you have a periodontal infection in each one of your teeth or some of your teeth, and that's an infective process that can travel into the circulatory system because you have every time you chew, there's a what we call a gingival sulcus. That it's a barrier. You know how there's barriers like the blood-brain barriers, etc. Every time you chew and you have an infection, those pathogens, and there's a lot of nasty bugs that get into the systemic circulation. They go into the liver, and they kick off a cytoplasmic transcription switch called nuclear factor kappa beta. which turns on all the inflammatory pathways. And it elevates C-reactive protein, and it causes your whole body to be revved up and inflamed. That's the connection between chronic inflammation and periodontal disease.
Okay, now we want to talk about each individual tooth in a minute, because there's also connections there between other parts of the body. But regarding this, the nasties underneath your teeth, that's what a lot of people are being told not to do root canals. Now, you do something in your office called Ozone.
Yeah, you bet.
What is Ozone, and how can it help prevent all this nastiness?
Ozone is like an inflammatory product on steroids. It's what it is. It's oxygen is two oxygen molecules hooked together. Ozone is 3 molecules hooked together. It's very unstable. It's antiviral. It kills viruses on contact. It's antibacterial. Kills, and I'm talking about pathogenic bacteria. It kills strep. It kills staph. It kills strep mutans. It kills just about anything that's a pathogen, and it does it very quickly. And there's no side effects. And it also increases an enzyme called eNOS, which is a long, lengthy term, which is a metabolic enzyme that increases nitric oxide. And it's called endothelial nitric oxide synthase. It revs that up, and what that does is that increases the dilation of the vessels, of the big vessels, and the microcirculation, which is where a lot of the problem is in the oxygen transfer in your body, is the microvasculature. So if you have an infected tooth, or if you have a tooth that's kind of troublesome, or arthritis for that matter, and there's a technique called Prolozone, which is developed by Dr. Frank Schallenberger, and you inject Ozone, and you inject 3 times or 4 times. We go up to 7 times in our office. You will get rid of the infection, you'll get rid of the inflammation, and basically it's a cure.
Without any of the negative effects of, say, an antibiotic or something like that.
The only effect that they've done they've experienced in about 4,000 cases is a Herxheimer reaction, Herxheimer reaction, where they've gotten sick from the dye off.
Oh, I see.
But that's it. That's it. I mean, it kills cancer. We know from German studies and European studies, it kills cancer.
Goodness. Now, we have 2 more minutes in this segment, so I just want to get a real quick answer about something that was really interesting that we touched on in the monologue at the beginning here, was that each one of the teeth in the mouth is connected to different parts of the body. Can you explain how that works and what can it do?
This stems from traditional Chinese medicine. And they've developed meridians that the teeth are like little circuit breakers. They're like little batteries in your body, and each one is connected to an organ system. I'll give you an example. There's a very famous physician in Switzerland called Thomas Rau, and he's an oncologist. And he took a bunch of his patients, maybe 400 to 500 patients, that had breast cancer. And he said, I want to see if there's a connection here between breast cancer and failed root canals. And surely he found a 98% correlation rate between his patients that had terminal breast cancer and had failed root canals that had infections at the end of the root canal, in the upper first molar region and in the lower second bicuspid molar region. So those teeth are intimately connected to the breast meridian.
So very specific teeth for that specific disease.
Yeah. There's kidney connections. There's nasal connections. There's intestinal connections. On our website, we have you can order these sheets.
So long story short, if there's a problem with that particular tooth in your mouth, it might explain a problem that you're having in your body related to that tooth.
Oftentimes, what happens, Scott, is people will come in and they say, "Hey, my lower molar here really hurts. It's killing me." Well, that lower molar is connected to the intestine, and so. But you take an X-ray, there's nothing wrong with it. You do your screening, there's nothing wrong with it. And I can't tell you how many teeth have been pulled or have had crowned or had fillings done or root canals, and the problem still doesn't go away. And those can lead to osteocavitations too, by the way. But then you say, there's nothing wrong with your tooth, but what's up with your intestines? And they're like, oh, how'd you know that?
Interesting.
And so you've fixed the intestinal issue. You've just now fixed the tooth issue without doing anything.
Wow. We're talking about some very enlightening things with Dr. Thom Lokensgard. We'll be back with more from the Health Awakening. Stay tuned. Welcome back to the Health Awakening. Before the break, we were talking with our guest, biological dentist, Dr. Thom Lokensgard, about all kinds of health problems that can be a result of teeth that you may not have realized. Another thing people may not realize is the damage that can be done by conventional dentistry.
Right.
What can happen? Well, people don't realize.
You're right. Dentistry, traditional dentistry, and traditional medicine can do some damage. Now, we do some wonderful things too. Okay, we do some really great things. So I don't want to diss it, but dentists are the only group of medical practitioners that I know of that actually leave dead tissue in the body, and that is a root canal, because we're so ingrained in trying to save teeth. But you get to the point where, it's really not worth saving an infection that's causing all these issues, these other issues that we talked about, all this chronic inflammation, because we now know we've linked chronic inflammation to aging. And so the whole anti-aging thing is go ahead and get rid of the inflammation, and you've just made yourself a little better, a little healthier. But we see a lot of people who come to us, and they have all kinds of issues. And they say, we've been told by our dentist that we have 14 cavities. We've been told that we need a root canal. We've been told that we need multiple crowns. But in every case, the non-biological dentist will leave the mercury in the mouth. So now you have a mercury filling that leaks mercury. The IAOMT knows this, the HDA knows this, the IABDM knows this, but the ADA for some reason doesn't quite get it, and I'll just stop right there. I'll get myself in trouble. But we all know that having mercury in your mouth outgasses. You just go to our website, go to the IAOMT website, and you can see every time you drink something warm, hot, coffee, for example, chew something, you're outgassing mercury vapor. And mercury vapor is deadly.
So now, aside from the mercury, if someone is told they need a root canal, are there other options?
Yes. Good question. There are other options where you can save a tooth that is in a reversible mode. You can actually reverse the inflammation with ozone. You can actually save that tooth. And we do it quite a bit, but it takes up to 7 injections to do this. If the tooth is blown out, we say if the horse is dead, you got to get off. It's just the bottom line. So you have to take the tooth out, and then you can go the implant route, or you can go a flexible partial route, which is a nylon type partial, or you can just do nothing, or you can do a fixed bridge. Like I said, we get patients every day that come to our office and they say, we need this, we got a big treatment plan here, and a lot of those people. And people might not want to hear this, but there are corporate dental offices out there that are pretty much into production. It's just a drill, fill, and bill factory. It's a dental mill. And
one of those my wife fell into the trap of was they say, you have 4 wisdom teeth, you need to get rid of them.
Yeah.
And we went to you, and you said, no.
No. If the teeth are fully erupted, they're in position, they're not mesioangulated, they're not pushing. You can cause more damage. Speaking of the damage you can do, you can cause osteocavitations, which are little bony infections. They're like osteomyelitic infections in your jawbone, and they sit and they smolder and they cause all kinds of inflammatory issues and processes.
Interesting.
So we'll take an X-ray, we'll take a pan, or we can do a CBTC scan and determine whether there's an infection there. And if there's no infection and there's room, leave it.
Interesting. Okay. And what about my wife's situation was they had called for 4 crowns on these wisdom teeth. And that's not often necessary.
Whenever you drill on a tooth, you damage it. It's just the bottom line. And so what in our clinic, what we do is we use very low-speed electric high-speed drills, if you will. So we're not damaging the tooth by real high-speed, hand pieces.
Gotcha. Okay. Well, a couple other questions. A little bit of a speed round here. We only have 2 minutes left.
Okay.
A few of the members of our team here would like to know a few things.
Okay.
Toothpaste. Conventional toothpaste on the shelf, is it junk?
Stay away from fluoride.
Okay.
Stay away from sodium lauryl sulfate. Essential oils are great. We haven't even mentioned essential oils, but essential oils and toothpaste is good. Alkalinizing pastes. Get into oxygenating agents like ozone. There's ozone gels. There's a substance that we use called Argentin 23, which is an antibacterial. It's a nanotech silver hydrosol compound, and that's great. But there's a gazillion pastes out there. Just use them without fluoride and without sodium lauryl sulfate.
So could someone make a homemade thing with baking soda, coconut oil, and an essential oil?
Truthfully, what I do, coconut oil, baking soda, and maybe a little essential oil, maybe some peppermint oil.
Interesting.
That's it.
You have a list of 48 myths.
Medical and dental myopic myths.
Yes. Now, what is the most important one you see, a myth out there that you want to dispel?
Cholesterol causes heart attacks.
Really? Okay.
And Lipitor is the answer to solving that problem.
Okay.
and again, unless I get myself into trouble with the medical profession. But one of the aha moments in my career was when I was sitting in a anti-aging conference with about 3,000 physicians. And Dr. Stephen Sinatra came in and said, so how many of you guys still believe in the cholesterol myth? And I'm like, okay, well, I guess I still do. And he said, I'm here to tell you, it's not cholesterol. Cholesterol's at the scene of the crime, but it's not guilty. And it's oxidation and it's inflammation that causes heart attacks.
Wow. Enlightening stuff with Dr. Thom Lokensgard. We'll be back in just a minute to wrap this up on The Health Awakening. Stay tuned. And welcome back to The Health Awakening. Well, we're going to have you back, Dr. Thom Lokensgard. We've got way too much to talk to you. I know one thing we wanted to get onto our list before we leave is remineralization of the tooth.
Right.
People say it's just a dead thing. You can't remineralize it. Truth or false?
False. You can remineralize because there's this process called demineralization and remineralization. That's tough to say. And there's a process going. It's all about mineral content.
Okay.
Mineral content and pH. And so if you add, what we've done with our water sources, we've taken out all the minerals, and we know that our soil has no minerals in it anymore. So minerals are essential, and essential means that they're necessary. Your body doesn't make them, just like essential fatty acids. So yes, you got to take mineral concentrates. We've got on our website, we've got a whole protocol that we're launching that tells you how to do this.
Wonderful. Okay.
So the answer is yes.
Thank you. All right. Well, in short, we'll have to go to your website and find out more. So thank you for joining us today. Our guest has been Dr. Thom Lokensgard, the founder of the Center for Holistic and Biological Dentistry in Nashville, Tennessee. You can watch the replay of this episode and see our complete show schedule on healthawakening.tv. For more information about Dr. Lokensgard and how he can help you, visit healthawakening.tv/dentist. And we'll see you next time for another Health Awakening. Thank you for joining us today on The Health Awakening. You can catch the replay of this episode and see our complete show schedule at healthawakening.tv. For more information about our guest today and all they have to offer, please visit their website on the bottom of your screen. And please remember, the information you saw today is for educational purposes only. It is not medical advice, nor do the views expressed reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result. Thank you.